Our next session is another important topic, and it's called Navigating Your Osteoarthritis Journey from Diagnosis to Surgery. And this one will take us through the care path, if you will, from one of the field's top leaders. And I want to bring up to the stage Lauren Rava from Johnson & Johnson to explain more.
Thank you so much for having us today. Before we jump into our speaker, we're just going to show a short video talking a little bit more about our My Health Can't Wait campaign from Johnson & Johnson.
Health is everything, but for many people, quality care is out of reach. That's why Johnson & Johnson partners with nurses, community health workers, advocacy organizations, and patients, so that everyone has the opportunity to live a healthy life. Through My Health Can't Wait, a J&J Care Community initiative, we meet people where they are, expanding access to care and helping bring the clinic to the community. In 2024, Johnson & Johnson employees stepped up, volunteering at over 30 events across the U.S.
We are helping individuals identify opportunities to save their life by prioritizing their health.
Together with our partners, we have reached more than 130,000 people, provided nearly 38,000 partner-led health screenings, and distributed over 39,000 educational resources.
Our approach for closing the gaps between community and care is quite unique. In a way, we're blazing a trail for corporations to work with the community, with partnerships for the community.
I'm here because I volunteered to help spread the word that it's important. Health is important.
When care is within reach, we can build stronger, healthier communities together. Visit myhealthcan'twait.com to learn more.
Thank you so much. So as you can see, My Health Can't Wait. We're visiting cities all around the country. So please share with your friends and family. We'd love to see you all out there. We're also here today kind of directly this way to talk to you more about our resources, including our family health history tree, coming off of the last panel, talking a lot about family health history. I think we can all agree that's really important, and we have resources available for you to help track that with you and your family. But without further ado, I'd love to introduce one of our leaders to talk more about orthopedics and all the options available. I know we spoke to some of you today about perhaps your fears or hesitations, so I'm really excited to have Andrie up here today. Andrie Leday is the U.S. Commercial Vice President for Joint Reconstruction and Enabling Technologies for J&J MedTech Orthopedics. He has over 20 years of successful sales and leadership experience in the healthcare industry and is passionate about ensuring that all patients have access to the best care and treatment technologies possible. Andrie has a Bachelor of Science in Marketing from Texas A&M and a Master of Business Administration and Healthcare Management. When he's not at work, Andrie likes spending time with his family, college football, traveling, and DIY projects, and he is from the Austin, Texas area. So please give it up for Andrie.
First of all, I want to say thank you for the warm welcome, warm invitation to this amazing event. When I see all the healthcare providers here, when I see all the volunteers here, it just makes me so proud to see so many people willing to stand in the gap for our healthcare needs, to stand in the gap for the information that helps make us all better. So with that, I'll advance the slide. Again, my name is Andrie Leday III, so that means I have two parents who I'm very proud of, and they'll come up in this conversation a little later, but Andrew and Joyce Leday, I'm their oldest son, one of four. So as we talk about the agenda for today, we're first going to talk about what is osteoarthritis. We're going to have a few facts about joint reconstruction as well as joint replacement and the pathway of this disease. And as we move along this conversation, we'll also speak a little bit more about knee replacement surgery options as well as patient testimonials, and then we'll have some of your questions. So some quick facts about joint replacement. Pop quiz. First question, what disease is the leading cause of disability in the United States? I probably gave this one away. Let me show a show of hands. Is it A? No. Is it B? I hear B. Is it C? Is B. Osteoarthritis, work-related occupational health. Oh, I just advanced that one a little too far. Everybody got a bonus point for that one. So how many joint replacement procedures done in the United States each year? Over 1 million. And last but not least, what's the most mobile joint in your body? The knees. So I hear A for shoulder, B for knees, and C for hip. Shoulder. Trust me, by the end of this, everyone will be experts, so don't worry about it. So as we talk a little more about osteoarthritis, just want to look at the scope of the problem. And this is one of the most common forms of arthritis. And it'll manifest in wear and tear in your joints and grinding away at your cartilage. You're going to have symptoms like pain, stiffness, swelling, as well as you're going to see changes that develop slowly and they only get worse. It does not get better. So any type of joint change that you're going to experience is typically irreversible. And often it goes undiagnosed until it progresses to a point where it's much more difficult to manage. I'm going to stop right there for a second. This is an opportunity for us to all, as we're getting all this information, one of the key notes that I've heard throughout these conversations and presentations today is to listen to your body. Be honest with yourself and be honest with your provider when you go in. I love my parents. I spoke about Andrew and Joyce earlier today. One of the things that Andrew and Joyce are known to do is have different conversations at home than they have when we're sitting in that room with the doctor. It hurts like the devil when we're at home and I'm running back and forth to go grab something because their knees are hurting or their hip is hurting. But we get in front of the doctor and ask him, hey, what brings you here today? Oh, it's a little stiff, but it's all right. It's not that bad. So I'm going to challenge us all to be honest with ourselves, honest with our bodies, and honest with our providers today. So why is osteoarthritis so prevalent today? One, we're all getting older, and we're all getting a little bit heavier. Overweight women are 4 times more likely to have the risk of developing knee osteoarthritis, but men, we're not getting out of this either. Men are 5 times more likely to develop osteoarthritis if we're overweight. And for those who suffer from diabetes, that prevalence is actually 2-fold in each of those populations as well. So how do we diagnose these problems? Oftentimes, the doctor is going to ask for your medical history. You're going to have a physical exam that's going to look at the source of your injuries or your pain. And they're also going to look at the location of that pain and determine the extent to which your joint has stability or instability. And so beyond that, the doctor has tests, everything from an X-ray to an MRI to help in that endeavor. Some of the examples of these treatment pathways are going to start with non-pharmaceutical and non-pharmacological options first, which are, of course, self-management skills, stretching, all of those opportunities, yoga, getting physically active, losing weight, which again takes most of that weight-bearing burden off of your joints, and then also choosing activities that are easier on your joints. So I don't know how many folks in this room are pickleball players. Any pickleball players? Hey, I'm gonna tell y'all, pickleball is the devil. It is a wonderful sport, but it is the most humbling thing that I have ever played. And you want to talk about, I didn't know how old I was until I started playing pickleball. That pickleball is something else. Medical interventions. So obviously there's an opportunity for have pain medication, Tylenol, ibuprofen. There's also topical medications. I think those, who's ever used Tiger Balm? Anybody ever used Tiger Balm? Blue Emu, any of that? It made the list, so y'all doing okay. And then, of course, joint injections, whether it be corticosteroids or even the hyaluronic acid, which is also known to provide some relief as you manage the disease. And then last but not least are going to be the surgical interventions, which can lead to anything from a minimally invasive approach to relieve some of the strain of the osteoarthritis, but also there's an option for partial knee replacement as well as full joint replacement. So I think we've talked about this. I'm going to advance just for the sake of time, just looking at body mass indexes and challenges. So the challenges with obesity and weight loss is finding the treatment option that's right for you. And if you've tried different options for weight loss, you may have not been successful, but there are additional treatments and options available. This is a prime opportunity to also put a plug in for the GLP-1s that are currently out in the marketplace. I know that so many people have found relief in that space and found an opportunity to manage their weight with GLP-1s. I would just encourage them, take advantage of that newfound relief and keep your body moving. Find the rest of the relief that comes with the salvation that those products provide. So when you're deciding on whether or not to have your joint replaced by surgery, there's a few signals that you may want to consider if it's time for you to have your joint replaced. Number one, if you can no longer complete your routine daily task without help. Number two, is there significant pain? Pain that keeps you awake at night despite using medications, pain that keeps you from being able to walk or bend over, and pain that isn't relieved by rest. This is pain that typically isn't helped by non-surgical approaches. Number three, your doctor says that less complicated surgical procedures are unlikely to help. Number four, you have osteoarthritis and you feel that disease is wearing you down both physically, emotionally, as well as mentally. Number five, you are suffering severe side effects from your medications. I think that was brought up earlier. And then number six, the tests show that the osteoarthritis and the advancement of arthritis are significant in that bone and joint damage. So we'll take a couple of looks at that as well. So should I wait to have joint replacement? I can just do it later on. It's not that bad, like Andrew once said. Andrew has since then, by the way, had hip replacement, and he's doing fantastic. For OA patients requiring surgery, it is often provides pain relief and functional improvement. So early diagnosis and treatment are important. Delaying surgery may lower your quality of life, as well as osteoarthritis is degenerative. So it won't get better, it actually may get worse. So again, studies show as well that patients who are an ideal candidate for joint replacement surgery actually do better from a rehab perspective the earlier they're able to catch and diagnose the disease. It can also mean the difference between having a partial joint replacement versus a full joint replacement. 4 myths. I wish this was a quiz. I think you all would have done fantastic. 4 myths about joint replacement. OA pain is a part of just aging. It's a part of getting old. We don't have to hurt as we get older. We don't have to become immobilized as we get older. That is not a natural part of the human design. I'm too young for a joint replacement. Depending on your body, depending on the activities you've had throughout your life, depending on your family genealogy, there are so many different things that say when our body is ready or not ready to have a joint replaced. We literally just had someone just this past year with our joints in their body run the New York Marathon. So this is an opportunity to, again, extend life. This is an opportunity to keep it moving, and it's not necessarily related to getting older. And then I should wait as long as possible to have my joint replacement surgery. It's just hurting a little bit, so if I wait another 5 or 10 years, this will be a good time. I will tell you that the advancements in implant technology have surpassed what they were many years ago. So the joints you have today will last much longer than previously understood. And also, too, you have to consider the payoff or I would say the risk benefit of waiting longer. How many more years do you have to not enjoy theme parks with your family, your grandkids? How many more walks and how many more pickleball games do you not have an opportunity to enjoy as a result of waiting? And then all joint replacements are the same. That is also not the same. So if you've had a friend or a family member that's had one experience with a different joint, it's not going to be necessarily the same with yours. And we'll talk about some things that have made it even better today. So is knee pain holding you back? Cause of the pain, as you see here, that's a healthy knee. On the left side, you're going to see you have healthy cartilage in between that acts as a cushion for your joints. And then as you look at diseased knees, you're going to see a lot of wear and tear and deterioration of that natural cushion, and that's where that pain is coming from. You're going to have that bone-on-bone feeling of that pain and that grinding. And again, we don't have to have that anymore. That's not natural. Again, there are knee injection options, hyaluronic acid injections, which do provide some relief for quite some time. So as you're considering whether or not you're ready for surgery, your doctor may suggest these. These have been seen to be highly effective in some patients, and for some, it's enough for them to not see progression of the disease. As I said before, sometimes the disease progresses slowly, and sometimes it's presented and maintains that level for quite some time. Typically, it's given one injection. Single injection is either weekly or 3 to 5 weeks, depending on what product is used and what the pain relief is needed for up to 6 months. And then, of course, there's corticosteroids. I would say, again, this is an opportunity to manage acute pain. It has some, I would say, medial benefit to management of pain. It's great for flare-ups, but if there's pain that lasts for more than a few days or 6 months, this is typically an option as well. Oftentimes, these are not used frequently. Of course, they can contribute to cartilage breakdown. So again, I think that's been shared earlier. So common types of knee replacements, you can either have a total knee replacement, or you can have what we call a unicompartmental knee replacement, which is just a portion of the surface of your bone that may be diseased, and the other portion may be just fine. So it's a much more, less, I would say, complicated surgery, and it's one that has really strong rehab results, as well as total knee. Total knees have actually advanced to the point that for many that are concerned about going to the hospital for your total knee procedure, you can actually go to an ambulatory surgery center or a day surgery center now for knees, and you can have them done in the same day and go home. And I know historically, it's been thought taboo to have something as major or as significant as a knee surgery or a joint replacement to go home. You think, oh no, that's rushing me. Actually, the truth is, the sooner we get up and moving after those surgeries, the better the outcomes are for us. So please listen to those care providers when they say, I need you to get up and get walking. But the reality is, you can be hurting on a Monday and be post-surgery and pain-free by Friday. So there's an opportunity there for us to consider. So which implant is right for you is going to depend on a number of factors. Your range of motion, your stability, your current wear characteristics in your knee, your lifestyle. So are you, taking walks in the park, playing pickleball, going scuba diving, whatever it may be, or are you still working? A lot of us are still working. I've got 4 kids. 3 of those kids are my beautiful daughters. So I will be working till I'm 80 years old between weddings, college, everything else. And so I got to keep all this together with duct tape or whatever it may be for a significant amount of time. So for those of us that are going to be working for some time, there's an option there for us to keep on working and stay healthy. Lifestyle, your age, as well as the severity of the disease. We have a variety of very unique implants across the market space that make it a very personalized experience. So one knee doesn't have to fit all. And then something else I'm really excited to talk about is our VELYS robotic assisted solution that's currently on the market. It's innovation in robotics. It's actually the most recent addition to the robotic space for osteoarthritis and knee replacement. What's unique about this system, it actually helps to assist the surgeon with the technique and technology to make sure they get the cuts right and get the positioning right and the balancing right the first time. It's a guide to help them. It actually can be leveraged by using something as simple as an X-ray to register the anatomy. And it has the ability to provide, again, designed for you, the digital precision and it actually allows for the tailoring of a very unique plan per patient. So not all patients are the same, so the procedure doesn't have to necessarily be the same. This takes all that information about your unique anatomy and helps to produce a result that most mimics, in combination also with our kinematic alignment techniques, your body's more natural gait. So I don't know if you've seen people that have maybe had procedures many moons ago on their knees, and everyone comes out walking a certain kind of way with a little hitch in the giddy up. Well, with this technology, if you're pigeon-toed, if you're not kneed, whatever it may be, you can still be slightly pigeon-toed and not kneed. That way we're not changing the muscles in your body and not changing the way you walk, changing the way your clothes fit, you name it. So this actually corrects your knee without changing your gait. It most naturally mimics your body's natural movement while correcting the problem. And it's used exclusively with our attuned knee system, which is designed to also deliver a greater range of motion and faster recovery for patients. So it's really critical that we get in shape for surgery before we go to surgery. So we need to stop drinking. If we do like a little alcohol, we got to stop. Unless you share with the surgeon. Just kidding. Stop smoking. Smoking is shown to actually hamper our ability to heal and heal properly. So please stop smoking if you do smoke. Weight loss. Anything we can do to reduce our complications on our weight allow us to have the ability to get up and move sooner than later. And then daily exercise, again, preparing that body for that post-surgical life that you're going to live. So it's really important for us to do that. What to expect after knee replacement surgery? Rehab starts right away. They are not being bullies when they tell you to get up and post-op and they walk you down the hall. It is important to get your body moving. It is important to make sure that you keep all of that loose. You don't let scar tissue and other things develop. So it may feel like a grind for a day or so, but keep your body moving post-op. Rehab and recovery. Again, soon after, it's going to sound like a theme here. You're going to need to get up and keep moving. So begin walking short distances. You can walk with a walker to get a little assistance until you feel comfortable, or crutches. And then when you leave the hospital, you're going to gradually increase that walking time and that walking distance. Also, some patients benefit from physical therapy. That's also provided by agents that may come to your home, or outpatient therapy. Important safety information I want to make sure I share. The performance of joint replacement depends on your age, your weight, activity level, and other factors. There are potential risks, and recovery takes time. People with conditions limiting rehabilitation should not have this surgery. Only an orthopedic surgeon can tell you if knee replacement is right for you. Quick patient testimonials, just so you know, you're in good company. I know you can't see these, the print is rather small, but we've got Kitty here on her bike. She's had a left knee replaced, right knee replaced, left hip replaced, right hip replaced. Her next replacement is free. Life after surgery. She said, no pain. In my hips and knees, and after 9 weeks of PT, I'm back on my bike. These are true testimonials. These aren't made up. And then we've got Dave. Dave had a right hip and a left hip replacement. He said it's incredible the difference, the arthritis side of things. That's the big thing. When you lose all that nagging feeling that you've been suffering for such a long time, it's like night and day. I'll just again share about Andrew and Joyce. So Joyce also had knee replacement surgery. And I can tell you, her life has been so much better. She's back to gardening. She's back to going out with friends from high school. She's just enjoying her life now. So I've got my dad with his hips, my mom with her knees. I'd encourage anyone, again, just seek out the options, have the conversation, take care of your body. So in summary, osteoarthritis is degenerative. It's the leading cause of joint pain. Early diagnosis and treatment are critical. And Johnson & Johnson MedTech offers joint implants in a wide varieties of shapes, sizes, and materials. So an orthopedic surgeon can recommend the implant that's most appropriate for your situation. Any questions?
I have a lot of anxiety
Yes.
because I cannot get an MRI on my shoulder because I'm waiting for authorization. And the last time first they were going to give me a CAT scan. I do have a pacemaker, but my cardiologist said I could take an MRI. No, the thing of it is, and I found out that my orthopedic did not send in the x-ray.
Yes.
So I could do my CAT scan.
So-
Now, what's going on with the MRI if everybody's, well, what do I do now? They say I just have to wait, but I can't wait. I'm 71 years old. I definitely am not getting younger.
Okay, well, first of all, thank you for the question. Thank you for being the first brave soul to ask a question. I will say I would never stand up here and second guess what your surgeon or doctor is providing for counsel. But what I will say is what is unique about the VELYS system, it does provide for the ability for your knees as well as your hips to be registered via x-ray. Now, with regards to shoulders, we have several techniques, again, with the appropriate surgeon guidance that are actually tissue-sparing opportunities for both the hip and the shoulders that are very unique. So I would say continue to find the right surgeon and the right providers that can answer the questions to your satisfaction. What I will like to introduce, they're over there on the wall. We happen to have our global vice president for knees, Brian Collins, here in the building with us. And we also have our local leader, Ryan Vinishek, here as well. So as far as, guidance and opportunities to find, I would say, surgeons in this area that may be able to more appropriately answer the question, I'd point to one of those gentlemen to possibly speak with them after this talk. Any other questions? Yes, ma'am. Yes, ma'am. So I will say Johnson & Johnson also has a full range comprehensive spine offering as well. Which also includes a brand new addition to the robotic space, which I'm very proud of this advancement in technology. It actually offers multi-segmental registration and tracking of your spine as they're doing the procedure, which is a first of its kind. So that way, if your spine moves or as it moves when they're doing any type of work, they can make sure that you have the right alignment as well as a full new array of implants that go with that. But again, it's going to be the same recipe. You're going to want to talk to your provider, go through the necessary steps, but listen to your body. And if you've done that, I would say continue to find a different option because there's a multitude. I came from the spine world before this. There are a multitude of options, whether it be pain stem for your spine, there's microdosing for your spine, and all of those things leading short of having any type of reconstruction on your spine.
We have one more question in the back, real quick.
Hi. Would getting a knee replacement resolve the osteoarthritis?
It will remove for that particular joint that osteoarthritis. And so what you're looking at is essentially taking the three components that make up your knee will then be replaced in a total knee. In a uni, you'll just basically replace just a portion of your knee. So in those instances, we find the area of disease and then remove it and then replace it with the implant.
Okay, I have one more question. Is it advisable for somebody to get knee replacement? I'm a candidate for knee replacement. That's why I'm asking these questions. If you have the circulation below your knee is not that good.
Yeah, again, that's going to be a very specific question. And what I would say is, one, I would never want to make that judgment call on the stage in front of a few hundred people. But I will say there are options and techniques, but I probably would advise us, let's have a conversation with these gentlemen over on the side here. That would be more appropriate to answer in a one-off setting.
Okay, thank you.
Thank you. Thank you all.
All righty.